And representing the Ihangane Project are Dr. Wendy Leonard and Teofilia Huriro Uwaku.
Hi, my name is Wendy Leonard.
Hi, my name is Teofilia Huriro Uwaku.
And we are from the Ihangane Project. We are achieving lasting improvements in health outcomes in Rwanda by promoting local innovation within the existing national health system. The tools we create are shared with the Rwanda Ministry of Health to improve their implementation strategies. We believe that nurturing this relationship between mothers and healthcare workers is essential for long-term healthy communities, and we promote local health innovations or health systems that strengthen this relationship. Iheza Digital Health Record is a perfect example of our work, and it is the novel idea that we have submitted to the genH challenge. Iheza is a permanent health record for mothers and children with the potential to become a full family health record over time. It is designed by and for nurses and mothers to support their workflows. It inspires healthy behavior change through the use of data trends. It delivers timely and reliable data to the Rwanda Ministry of Health, and it's a revolutionary approach because it demonstrates it's possible to create tools that support this relationship while also increasing adoption of national health strategies. So why does it matter that we design health systems to strengthen this relationship? Well, I'd like to introduce you to Odette. Odette brought her daughter to a rural health center in Africa. She waits for hours because the nurses are overwhelmed by the number of patients and the lack of needed resources. She finally sees the nurse, and the nurse checks her baby's height and weight, writes the numbers on her hand. She doesn't have anything to compare to in terms of previous measurements. She estimates that the baby has moderate malnutrition, and she tells Odette to go home, breastfeed more often, and return in a month. Because the nurse was so distracted and busy, Odette did not feel comfortable telling the nurse that she couldn't breastfeed because she had a severe breast infection. So Odette returned home, came back 1 month later, but this time the baby had life-threatening severe malnutrition. She was hospitalized for 5 weeks. Luckily, she gradually improved. But imagine the resources that could have, or the suffering that could have been spared and the resources that could have been saved if only Odette's nurse had had the opportunity to see that her baby was losing weight over time and then have the opportunity to talk to Odette about those changes. Well, what if instead Odette's nurse had a tablet that she was wearing around her neck? When she entered measurements, she could see previous measurements color-coded by nutrition status and have access to real-time growth trends and Z-score calculations that allow her to tailor her health education for Odette and her baby. She could even print out that report and share it with Odette to take home with her. Well, with Iheza Digital Health Record, this is possible. Iheza is guided by gold standard clinical care protocols for pregnant women and mothers. It provides flexible workflow options where the user is able to shift between individual care and group health assessments that are possible in Rwanda, that are common in Rwanda and throughout East Africa. It allows nurses to use real-time data trends to reinforce healthy behaviors, and it connects to the Ministry of Health's data system, which is the same data system that is used by over 60 countries around the world. In addition, it is location and device independent. Iheza.
Our talented team is the key to our success. I'm a data specialist and lead Iheza team in Rwanda. I've been working with mother and nurse in the last 5 years to inspire behavior change through data trends. We have improved in quality of care by 150%, which led to 60% drop in malnutrition. All nurses are excited to use Iheza to build upon their work.
In April of 2017, we received the funding needed to create our pilot product. By June, we had contracted with our partners, and over the next 6 months, we conducted 3 development sprints engaging nurses and mothers at each stage along the process, and we will complete our pilot product this month. Securing $250,000 would allow us to expand Iheza throughout Rwanda by early 2020. In 2018, we will pilot the product in 9 health centers and begin expansion to 21 additional health centers, all while adding functions and connecting to the Rwanda Ministry of Health. In 2019, we will continually improve both the product and our implementation strategy by learning from the users we're working with. And by 2020, we will have expanded throughout the country. In doing this, we will have improved the quality of care to 4,000 mothers this year, 55,000 mothers in 2019, and 240,000 mothers in 2020. Our partners are excited about Iheza. The Rwanda Ministry of Health sees Iheza as a solution to the challenges they face in terms of accessing reliable and timely data, and especially in terms of their fight against childhood malnutrition. Our board member, Dr. Ngera Bega, is the Deputy Director of the East African Health Research Commission, and they are leading the e-health strategic planning process for all of East Africa. They are excited about the possibility of expanding Iheza through their member countries. Iheza was designed with key features that support the expansion through ministries of health around the globe, and any number of new modules could be added to address other chronic care conditions such as HIV, diabetes, or heart disease. Our open source business model allows for collaborative iteration and cost effectiveness. So we invite all of you to partner with us to create Iheza. Iheza is a digital health record with great potential for impact and scale. It is a revolutionary bottom-up approach to health system design, and you will be a part of a team that delivers. Thank you.
Perfect.
Sorry, was I getting waved at? Okay.
For questions from our judges.
Thank you so much for that inspiring work. I want to ask you a process question, first
Yes.
of all, and it's the process of how Iheza is going to be integrated into DHIS2. We've referred to it frequently, but talk me
Yes.
through the process.
Yes. So, in fact, we actually started this process because we wanted a simple data reporting system for our work. And we had a very simple format, and we brought it to the Ministry of Health just to let them know what we were doing. They were so excited about it. They said, you can do this, but you need to expand it larger and make sure that you're addressing all of the needs that we have as the Ministry of Health, and then we will link it to our system. So right now, the way it will work technically is that it will go to our server, which is built off Pantheon and Google, and it will connect, there will be an interface with DHIS2. But the goal is to actually move everything over time to the Rwanda Ministry of Health server in Rwanda and connect it to the DHIS2 system.
Okay, thank you.
Thank you.
Team, some questions?
In terms of, you've mentioned your expansion strategy with 4,000 mothers this year, 8,000, and then 9,000, and then 240,000. How is this going to be funded? Is it all grant dependent you've mentioned something about the Ministry of Health bearing the costs of equipment?
Yes, that's a great question. So in the pilot phase, we are funding it, and we're funding it through grant support. But we are working very closely with the Ministry of Health, and in our next phase, as we're improving upon the coding, we'll be working with someone directly in the Ministry of Health so that they can own the ongoing support. And as we expand beyond our pilot health centers, they will be covering the costs of the tablets and all of that. We will be helping, kind of transitioning support in that way.
Thank you for an inspiring presentation. Anything dependent on government in Africa doesn't last. How will you circumvent this?
Circumvent,
How will you go about it? Because one depends on the Ministry of Health, ultimately for sustainability. They have much, much more challenges and priorities. How will you go around this?
how will we go around the government challenges? So we are lucky in Rwanda that there is a really great commitment to an e-health strategy. And so there's already a digital health record in place that no one is using on the ground. And so Rwanda is very committed to this particular initiative because it gets them what they need as well. And in East Africa, they are also committed to this process. From the Ihangane Project standpoint, we can also continue to sustain our work through contracting and becoming experts and sharing how to implement in other communities as well.
Terrific job, both of you. Is your main focus at this point just getting this technology out there, or is part of what you're thinking of following up with these folks, the impact that it will have in improving health across the board for those who participate?
Yes, so there are a couple of pieces to that question. For us, this is a tool, but really what we see is that healthcare workers on the ground, they don't see the benefit of data. They feel like they have no resources, and they don't realize that data could actually be used to improve the care of their patients. Instead, it's seen as a burden that's reported upstream. So we consider this a tool in how to help healthcare workers improve and feel a sense of ownership over what they're doing. I'm also a physician in California, and the electronic medical records here are designed for billing first and secondarily for patient care. So the bigger picture is trying to say that you can design digital health records first for healthcare workers, for the end user who's going to be using this every day, and also meet all these other needs, but start with that as the primary goal.
I was just thinking about the complexity of trying to keep the whole system sort of up and running. Do you have, they may buy the tablets, but who sort of maintains and makes sure that out in all of these rural areas, how do you sort of have the infrastructure to sort of make sure the whole thing continues to run?
Unfortunately, we'll have to answer that in the cocktail hour.
Okay.
Just hit the
Okay.
5 minutes.
Thank you. Okay. Sorry. Got it? Thank you.
That was a good question, too. I wanted to know the answer. Thank you, Wendy and Theo, for that great presentation with Ihangane Project.